Hi, I'm Dr. Kawita Bapat. Welcome to Learn Simply Academy. The purpose of this session is to teach you about the algorithms, a real and a practical guide for the subject. Today's subject is twin pregnancy. Twin pregnancy, when we suspect the twin pregnancy, take a detailed history and perform the physical examination and be aware of the risk factors for the twins. Perform an ultrasound and diagnosis not confirmed and diagnosis confirmed. If the diagnosis is not confirmed, exclude other causes of excessive uterine size, wrong dates, fibroids, sometimes polyhydramnios. And the routine prenatal care is needed, repeat ultrasound examination as indicated. But if the diagnosis is confirmed with the ultrasound, initial management, confirm gestational age and fetal well-being, determine the zygosity and the chorionicity, consider the neonatologist, MFM, and anesthesia consultant, maternal fetal medicine consultants, and anesthesia consultants. Prenatal care specific to twins. Then, if there are dizygous twins, they are 80%, and monozygous twins are 20%. Now, the dizygous twins, 80%, it's a dichorionic or diamniotic placentation. Review the risk of diamniotic dichorionic twins. Consider the serial cervical length and fetal fibrinolactins. Screen the fetal structure and anomalies. Screen for fetal aneuploidy. Serial growth scans every 3 to 4 weeks starting in second trimester. Consider weekly fetal testing up to more than 34 weeks. And then intrapartum consideration, consider elective delivery at 38 weeks. Continuous intrapartum fetal monitoring, heart rate monitoring, and document presentation and the fetal weight, effective fetal weight of both the kids. And review the mode of delivery. When there are the monozygous twins, they are 21%. They are divided into 4 groups. First is a dichorionic diamniotic, then monochorionic diamniotic, monochorionic monoamniotic, and conjoined twins. Dichorionic diamniotic we have already dealt in a last slide. Now the monochorionic diamniotic, it's a 65%. Review the risk of mono and di twins. Consider the serial cervical length. Screen for the fetal anomalies. Screen for fetal aneuploidy. Serial growth scans every 2 weeks for TTTS. This is a twin transfusion syndrome starting in the second trimester. And consider fetal testing is more than 28 to 38 weeks. And then consider elective delivery at 34 to 37 weeks. If the monochorionic diamniotic presentation, now monochorionic monoamniotic presentation, this is a 5% less than. Review the risk of mono twins. Consider the serial cervical length. Screen for anomalies and fetal aneuploidy. Serial growth scans every 3 to 4 weeks. Then consider the continuous fetal monitoring up to 24 weeks. And then elective cesarean section at or after the 32 to 34 weeks. In conjoined twins, they are 0.1%. Counsel and the retermination. If declined, consult the pediatric surgeon and elective cesarean section at term.